times they didn't get the money to go for drugs. So you find that they end up defaulting and not taking the full treatment of TB, and then the disease recurs.
Women dying on the way because attending the maternity services at the far places.
So we have another woman around here. She was also going to give birth to the third born. The first born, she had given birth. The second born, now she was going to give birth to the third born. She also died when crossing the river from the hospital.
Fod Women Development Program was started in 1990. It started as a CBO and it used to be called Fod Women Group. That is before it became Fod Women Development Program. So the thrust behind the formation of Fod Women Group was the harsh conditions the women around lived in, and so women were so much sidelined. So when Fod Women Group was started, it worked with women. They were taught on how to fight for their rights. Their capacities were built. So you'd find they could shun certain traditional cultures. Yeah, they could now speak for themselves. When someone is sick, at times it's hard to cover. So you find like Makalda District Hospital, where most of them go, if you have to go to that place, you have to cross a river. And so at times you find that during rainy seasons, it's quite a challenge because you can't cross that river. It floods and there is, well, at times when the river bursts, you can't cross to the other side. So you find that in such cases, you will find that pregnant women, they'll definitely die. Yeah, if they can't get means of transport to ferry them to the nearest hospital, they end up dying, or they visit the TBS, traditional birth attendants, who sometimes are not there, or sometimes they don't have the protective gears or the drugs to give to them. So you find that in that sense, we've had several new infections.
In terms of health facility, in terms of seeking medication at the Makalla sub-district hospital is a problem, because when the river is full, the women get a challenge of crossing the river, and that because there's no bridge.
We've had several new infections, yeah, of HIV, because maybe at birth. When a pregnant woman doesn't give birth in hospital, and maybe she was HIV positive, so you find that it's easy for the infant to be infected. Yeah. And I think I can say it's the distance. And the is that the Pamoja for Change made the community members realize that they can also participate, and it really gives them the morale of contributing, the mood of giving towards solving their own problems.
As Pamoja for Change named detonates, it basically means bringing people together for them to be able to drive their own development agenda.
For example, they have the silk groups where they do table banking.
We give them a challenge of mobilizing 50% of the total project cost from sources within the community.
In this place, they get money, yes, through mining, but you find that they live in promiscuity. Promiscuity is so high in this place. So women are not dependent.
When these funds are collected together, KCDF is able to give them 50% of what they've been able to mobilize for them to do what they've been able to do.
Watch the companies around this place. In any case we have any, especially when it became a reality, the first time we got our first disbursement and we told them, you know what, tumepata hiyo disbursement ya kwanza, and they were so happy. Now you see the dispensary was one of the most felt need of the community. They really wanted a hospital in place. So when we heard about KCDF and their matching grant,
Orongo Village has got roughly 3,200 households, and all of them will be benefiting from the facility. The HIV and AIDS is too high. That is according to the health report that we have in the county government. So HIV AIDS is impacted in so many other factors. That is, a contributor of it is poverty, because our people depend, like in the gold mine. So they go for gold, and that's where people go for commercial purposes. So that's fueled the spread of the HIV and AIDS. Orongo is also in a remote area within the ward, within Makala Kanyarano ward. And I think last time we had members from the KCDF who visited the site. We went with them and visited the site. It also have the same challenges that the Ogongo community members had been facing. That's why they have taken the initiative to replicate the same project here to the Orongo community, so that they can also benefit from the same project that we get from KCDF and the other many donors.
As a community, we are planning to approach the companies around this place. In any case we have any project idea that we want to fundraise for, we will have to approach the companies around this place so that they also give back to the community, because we can't be able to raise all that amount by ourselves as a community. But if we can get help from the companies around this place, of which if we start early enough, we know it's going to happen.
The groups that we are working with are able to mobilize corporates indirectly, and sometimes with support from KCDF.
As a woman, doing something for the women and seeing the smiles in their faces makes me feel good.
When a community believes in itself and in their ability to do what they want to do, it transforms not only the development sector, but even the mindset, the social, economic, socio-political well-being of that particular community. So the benefits are just immense.